Colon cancer, also known as colorectal cancer, is a type of cancer that develops in the colon or rectum. It can affect both men and women and is one of the most common cancers worldwide. The good news is that, when detected early, colon cancer is highly treatable. That's why it is so important to detect it early on. In this video, we will discuss the early warning signs of colon cancer that you should be aware of. What is colon cancer? Colon cancer is a type of cancer that starts in the colon or rectum. It usually starts as a non-cancerous growth called a polyp, which can develop into cancer over time. Colon cancer can be asymptomatic in its early stages, which is why regular screening is recommended for individuals over the age of 50 or for those with a family history of the disease. Early warning signs of colon cancer. Changes in bowel habits. A change in bowel habits, such as persistent diarrhea or constipation, can be an early warning sign of colon cancer. It is important to note that not all changes in bowel habits are indicative of colon cancer and could be caused by other factors, such as diet or medication. Blood in stool. Blood in the stool can be a sign of colon cancer, especially if it is bright red or dark in color. However, blood in the stool can also be caused by other conditions, such as hemorrhoids or ulcers. Abdominal pain or cramping. Persistent abdominal pain or cramping, particularly on the left side, could be a sign of colon cancer. This type of pain can be accompanied by other symptoms, such as bloating or gas. Unintentional weight loss. Unexplained weight loss is a common symptom of colon cancer. This is because the cancer can cause a loss of appetite and interfere with the body's ability to absorb nutrients. While you are here, please click on the like button. Thank you. Fatigue or weakness. Fatigue or weakness can be a sign of colon cancer, especially if it is persistent and not relieved by rest. This symptom can be caused by anemia, which is common in people with colon cancer. Anemia. Anemia is a condition in which the body lacks enough red blood cells to carry oxygen to the body's tissues. Colon cancer can cause anemia due to chronic blood loss in the stool. Constipation or diarrhea. Persistent constipation or diarrhea can be a sign of colon cancer, especially if it is accompanied by other symptoms such as abdominal pain or cramping. Narrow stools. Stools that are narrower than usual can be a sign of colon cancer, especially if they are also accompanied by other symptoms such as blood in the stool or abdominal pain. Bowel obstruction. Bowel obstruction is a rare but serious complication of colon cancer. It occurs when the cancer grows large enough to obstruct the bowel, causing severe pain, nausea, and vomiting. Risk factors for colon cancer. Certain factors can increase your risk of developing colon cancer, including age. Colon cancer is more common in individuals over the age of 50. Family history. Individuals with a family history of colon cancer or polyps have a higher risk of developing the disease. Inflammatory bowel disease. Chronic inflammatory conditions of the colon, such as ulcerative colitis or Crohn's disease, can increase the risk of colon cancer. Genetics. Some inherited gene mutations can increase the risk of colon cancer, such as Lynch syndrome and familial adenomatous polyposis. Diet. A diet high in red and processed meats, low in fiber, fruits and vegetables, and high in fat can increase the risk of colon cancer. Sedentary lifestyle. Lack of physical activity can increase the risk of colon cancer. Screening for colon cancer. Regular screening for colon cancer is important, as it can detect the disease in its early stages when it is highly treatable. The American Cancer Society recommends that individuals at average risk of colon cancer begin screening at age 45. Screening methods include colonoscopy, a procedure in which a flexible tube with a camera is inserted into the rectum to examine the entire colon and remove polyps or tissue samples for biopsy. Fecal immunochemical test, FIT, a test that detects blood in the stool and can be done at home. Stool DNA test, a test that looks for DNA changes in the stool that may indicate the presence of colon cancer. If you experience any of the early warning signs of colon cancer, such as changes in bowel habits, blood in the stool, or abdominal pain or cramping, you should see a doctor. Additionally, if you have a family history of colon cancer or are over the age of 45, you should talk to your doctor about screening for colon cancer. Colon cancer is a serious and potentially life-threatening disease, but it is highly treatable when detected early. By knowing the early warning signs of colon cancer and taking steps to reduce your risk of developing the disease, you can protect your health. Thank you for watching and please subscribe.